Hi, I'm Dr. Kirsten Lewane, coming to you from River Valley Chiropractic, where we teach you to move well so that you can live well. And today I wanted to cover a stretch for the iliopsoas. So I have some runners and athletes coming in, and they're having some problems with pain in their lower back that's then radiating down or getting pain down, referring down into their legs. It's not radiating pain, it's referral pain down into their legs, sometimes causing hip pain or knee pain. It usually doesn't go past the knee. But what we're finding in common with these patients that are coming in is that they're doing activities that involve a lot of hip flexion. So things like my dancers, my runners, any sport basically that involves the legs, so your mountain bike riders, anything like that where you're doing a lot of hip flexion brings that iliopsoas in. So why does the iliopsoas get tight? Well, we sit a lot, and most of us have jobs where we're sitting all day long. And when we're sitting, we're actually, the iliopsoas muscle is actually in a contracted position. And so it's in a shortened position, and it essentially turns off, if you will. It's inhibited and shortened. So then we get up to go do our activity, and it wants to stay tight, and it doesn't want to release and elongate. So what is the iliopsoas muscle? The psoas muscle is the muscle that attaches essentially our back to our lower body. It's the only muscle that comes from the spine and then connects down on the inner part of our thigh. As the psoas runs down from the spine into the leg, it meets up with the iliacus muscle, which is on the inside of our pelvic bowl, and forms the iliopsoas muscle. So that's the muscle that we're talking about. It does hip flexion. That's its action, is hip flexion to bring the knee to the chest, or spinal flexion to bring the spine closer to the legs. So how do you know that's tight? Well, sometimes, like I said, I've got these people coming in and they've got lower back pain. Sometimes it's right over the sacrum, or what we call sacroiliac joint, sacroiliac pain and dysfunction, where it hurts right there. But they may be complaining of hip pain, or they may be complaining of knee pain with low back pain and hip pain. So I just wanted to go over a couple of great stretches that you can do in order to release that. We're actually going to use Pnf stretching, or proprioceptive neuromuscular facilitation type stretching, where we're actually contracting and then relaxing. That allows that muscle to release a little bit more by contracting it first. So we're going to run through two stretches that we're going to do today to contract and then relax that muscle that you can be doing at home to help release that spasm in the iliopsoas muscle that may be causing problems when you're exercising, running, or even standing upright, if standing upright is difficult. Because what happens is when that's in a shortened position is it's actually pulling your pelvis forward, or what we call lower cross syndrome. That same position you're in when you sit, it's pulling that forward when it's contracted, so then when they go to straighten up and exercise and run or bike, they get pain in the lower back. By loosening and elongating that muscle and getting that muscle to stretch out and not be in spasm, it's going to improve your stride if you're a walker or a runner, because it's going to allow for better hip flexion as well as hip extension when it elongates to get that stride. So we're going to cover a couple stretches. That's a quick synopsis. We have some other videos that go into more detail with the iliopsoas muscle, where Dr. Will shows on the spine and explains it's where it starts and where it attaches, and you can go back and review those if you want to know some more about the anatomy. But let's get into a couple stretches here. So first of all, I want you to just lay flat on the ground with your hands at your side, and just kind of evaluate, what's this feeling like? What does your low back feel like when you lay down? Does it feel tight? Does it feel like your back is super arched, or is it flat to the floor? Does it feel painful when you lay here? Just kind of take a few deep breaths and just kind of figure out, what is your low back doing when you're laying in this position? So after about 3 deep breaths, you're going to go ahead and you're going to breathe. We're going to do what's called a knee to chest, Pnf stretch. So what you're going to do is, first I'm going to have you bring your right knee towards your chest. And then what I want you to do is, using your hands, I want you to push on your thigh as your thigh pushes back this way, okay? So your leg's not moving. but you are creating, if I let my leg move, it would go that way. If I didn't push, it would go this way. So you're creating a force against your thigh. As your thigh pushes this way, you're pushing this way with your hands, and you're contracting for 3 deep breaths. So you're going to hold and contract. This is shortening and contracting that muscle, the iliopsoas muscle. Those muscles are contracting as we do this. After 3 deep breaths, you're going to relax it. Let your side come back down. Put your hands by your side. And then compare side to side. What does the right feel like compared to the left now? Because we just contracted and relaxed the right iliopsoas muscle. Does it feel looser? Does it feel like it has more length? And after a couple deep breaths, we're going to do the same thing with the left leg. So bringing the left knee to chest. Again, I'm going to push a force into my leg as my leg pushes this way, and I'm going to hold that contraction for 3 breaths. And then once you've taken 3 deep breaths while holding that contraction, again, we're going to let that leg go down flat. Let your hands lie flat. And again, compare right to left. And was one, you can kind of evaluate yourself. Was one were you able to push harder? Did you have more force in one than the other one? Did one feel weaker? It gives you an idea, maybe some imbalance between the 2 sides. So now we've done the right and the left. We're going to do both together. So you're going to bring both knees to chest. And again, using your hands on your thighs, you're going to push this way while your legs are trying to push this way. Again, for 3 breaths. And then once you've taken those 3 breaths, again, relax and see how that feels. Now notice how your low back's feeling. Notice if the curve is different, if there's less pain, less discomfort in the low back, okay? So that stretch alone might be enough to get you started, especially if you feel like you have a lot of arch in your back or a lot of low back pain. That may be enough. But you may want to take it deeper, and you may want to do one a little bit more that provides a little more stretch. So we're going to take it to the next level and add a bridge variation to this stretch, doing a similar thing. So I have a yoga block here, and I'm going to use the medium setting of the yoga block. So this is the short, this is the tall. I'm going to do the medium. And lying flat on my back, again, same as last time. I'm going to take this block and I'm going to slide it under my sacrum, just above, just below, right, kind of just below your belt line. On your sacrum. And I'm going to relax that there. Then when that's there, I'm just going to keep my knees bent and just relax there for a minute. Get used to the block under there. Now, if this is too much, then you could take it down to a lower level. You could take it to the shorter level. But just kind of evaluate while you're there. And then now what I'm going to do after I've relaxed for a couple breaths, I'm going to bring that right leg up again. And I'm going to do the same thing. Force for 3 breaths. Contracting the muscle, contracting the muscles of the iliopsoas. And then taking that leg straight and letting it relax. And you can even press down on your thigh a little bit, and you're going to feel a stretch in that same muscle as the leg comes down. You're going to feel more of a stretch with this just because of having the yoga block under your sacrum. And then we're going to repeat the same thing on the left side. And remember, your breathing can also be affected by this muscle. If it's in spasm and tight, it can prevent you from taking as deep a breaths. So by getting this muscle to contract and relax will also help you to take a deeper breath as well. Bring that leg down, let it relax. And for me, my left side is tighter than my right side. And I do go out and run, so I do a lot of hip flexion, a lot of activity that involves hip flexion. And I just know for me, my left side tends to be my tighter side than my right side. And so I always do work on both sides, but I feel the difference left to right. Once I've done the right and the left, again, I'm gonna bring both knees up, push. And then if you can, you're gonna straighten both legs and let that iliopsoas muscle on both sides, those muscles lengthen. While you finish up with a couple of breaths and evaluate side to side if that feels even and how that feels. How does that feel different from the way it felt before you started the contract, relax stretches? So that's a small sequence for you to start with. I'm gonna follow up with some other videos that you can do later in the sequence. But like I said, if that first one, if you notice a lot of curve in your spine where your spine's further off the floor and you can't, kind of contract those abdominals, then just stick with the first one. But if you need more stretch, then you can move on to this one. So I recommend this for anybody who's doing a lot of sitting and is experiencing low back and hip pain and pain into the legs. But I especially recommend this for my athletes, for my dancers, my runners, my walkers, my bicyclers, anybody who's doing a lot of hip flexion. After you get back from your activity, add this into your stretches you do after the activity. We don't want to do this before we go out and run, but we want to do it after we've done our activity. This is great to add into your sequence to help counteract all the hip flexion you were doing throughout your activity to make sure you're not having spasm in that iliopsoas muscle. And that's going to help to relax. That's going to decrease any back pain, hip pain, pain into our knees, things that we're feeling as we do those activities. If you have any questions on this, please pop it into the comments below. If you have not yet subscribed, go ahead and do that. If you found value in this video or you know somebody who's struggling with kind of low back pain that's just not going away, share this video with them. And when you subscribe, there's also a bell notification button that you can hit, and that will let you know when we release other videos. Again, I really want to thank you for joining us today. Give us a thumbs up as well. My name is Dr. Kirsten Lewanek, coming to you from River Valley Chiropractic, where we teach you to move well so that you can live well. Thanks again. Have a great day. Bye-bye.